Very good evening, everyone. So, if we talk about the length from the midpoint of eyebrow, from midpoint of the eyebrow, if we talk about the length till the hairline, so this length is 3 chun. The total length of this area is 3 chun. From anterior hairline sound is there or not? Can you hear me or not? Sound is there, yes. From anterior hairline to the, if we are crossing the all hair and reaching to the back hairline, if we are reaching to the posterior hairline here till the last, so this length is 12 chun, 12 chun, 3 chun, 3 chun, 3 chun, and 3 chun. Okay, so the from the anterior hairline to the posterior hairline, 3, 3, 3, and 3. Total length is 12 chun, right? So this is the 3, this is 12. Now, if we talk about the neck, the length of the neck is also 3 chun. If I measure my neck, so I can measure my neck with the help of 4 fingers. If you keep your forefinger, then you can see the length of your neck is only 4 fingers. That is 3 chun. So let's see all the thing in the image. As per this image, the total length from the midpoint of eyebrow to the posterior hairline, this total length can be divided into part. Number 1, 3 chun till the hairline, and 12 chun after the hairline, we can see in this image. So 3 chun, the length of the forehead, and the 12 chun, the length from anterior hairline to posterior hairline. Right? We can even combine 3 plus 12. The total length will be 15 chun. If we measure the length of neck, the length of the neck also 3 chun. So here it's written. The length of the forehead is 3 chun. The length from anterior to posterior hairline is 12 chun. And the length of the neck is 3 chun. We can see with the 3 chun. Then this is the 12 chun, and again neck belong to 3 chun. Right? Now one more landmark we should be aware with that. So we should be aware with the bone. One is the zygomatic bone and another is the temporal bone. So if this is the ear, just above the ear, this is the temporal bone. And just next to eyes, that is zygomatic bone. Let's see here. We are trying to search the zygomatic arch, which will be very useful in the scalp therapy. So where our eyes are ending, we can feel the bone here. The name of this bone is zygomatic bone. We can feel the bone here, both the side. The zygomatic bone is the bone of the face. In the face, we are having total 14 bones. The two are zygomatic. This is the one side and this is the another side. Now, if we are going above the ear, the name of this bone is temporal bone. That's why we are telling, oh, temple headache, intertemporal headache. So now the temple bone is spreading on the back side, on the front side. It is a very big bone, temporal bone. So the temporal bone is coming here and touching the zygomatic bone. So where it touching the zygomatic bone, that is called zygomatic part, zygomatic process of the temporal bone. So this is the temporal bone, and this is the zygomatic part of the temporal bone because it's touching the zygomatic bone here. So if you see here, we can feel the bone here. If we do the different movement, like you see, if you open the mouth, we can feel the notch here. You can see here. This is called arch or the notch or the zygomatic arch. Why? Because it's made by zygomatic bone and the zygomatic process of the temporal bone. So if you open your mouth, you can see the arch. Who can see this arch? Tell me. This arch is reaching to the zygomatic bone. And just upper part of the arch, we can see the zygomatic bone here. This is the zygomatic bone here. Here. And this is the temporal bone. This is the touching the temporal bone here. So let's see in the image. So the E written here, E, that is the zygomatic bone. And this is the temporal bone. And temporal bone is touching the zygomatic bone with the help of this process that is called zygomatic process of the temporal bone. So this structure altogether is called zygomatic arch, like a bridge. This is the very important. In the future, we will be seeing that we are having very wonderful point for the lower back pain, for the knee pain, just next to the zygomatic process, zygomatic arch. So that time we should be aware with this landmark. So how many person can feel the zygomatic arch? Zygomatic arch. Good. Wonderful. Now we are moving to the very important part of the scalp that is called sutures. What is sutures? So first we can understand the suture. Look at the shirt, your shirt or my shirt. If you look at the shirt, look at here. There are suture here. You can see there are suture here. If I want to pull the shirt, if I am pulling my shirt, So tell me, can I separate my set from the suture? Can I separate these two parts or not? So answer is no. We can't separate because this is very tightly attached with each other. And when we tell regarding the suture here, the bone here and the another bone here, both bone are uniting together with the help of suture. We can never separate two bones. So we can separate this one, but we can never separate this one. The scalp suture are too tightly attached with each other, right? So when the baby is when we talk about the newborn baby, in the newborn baby, the process of suturing is going on. Okay. So the process of suturing is going on during the pregnancy, and when baby is taking birth, some work of the suturing is still going on. For some kids, maybe till the 6 month, for some kids, maybe for 1 year. So maximum till the 18 month. Maximum till the 18 month, the suturing is going on. Means attaching the right side of the bone and the left side of the bone with each other. This work is going on till the 18 month, even after the birth of the kid. That's why we can see when the kid is taking birth, we can see the soft part here. Soft part. Have you seen that soft part? So that soft part is called talu. In the Hindi, it's called talu. Talu. And because this is the hole, this is the foramen, this is the gap between two bones. But as the child is growing and reaching to the 18 month, then both the bones are uniting with each other with the help of suture. So remember one thing, whenever one bone and another bone are growing and the suturing is also happening between them, these all work happen under the effect of kidney essence. Kidney essence. Like kidney essence is powerful, then this work will be very faster. If kidney essence is weaker, then this work will be slower. So suppose one kid is having poor kidney essence, then this suturing work will be happening in the longer time. Okay. Many kids are having very deficiency of the kidney essence. They also might be suffering with the mental retardation. Okay. But having the suture here, it's a normal. So whenever we are doing scalp acupuncture, whenever do scalp therapy, we avoid suture. And we have to take care of the suture only till the 18 month, because many kids also coming for the treatment. One kid just took the birth and got paralysis, infantile paralysis. The parent might search some acupuncturist and they can bring the kids towards you. So you may have to start the acupuncture just after the birth of the kid. And we can do the acupuncture. Acupuncture is absolutely safe. But we have to avoid the fontanel if they are not closed properly, right? So this is the bone. The name of this bone is frontal bone. This is only single bone. This is the frontal bone, a single bone. Between the frontal bone, this is a very important area. Because here we are having a small suture. The suture means like there is a one attachment between this part and this part. Definitely we are considering whole frontal bone as a one. We are not counting the right frontal bone and the left frontal bone. This the whole frontal bone is a one, but we can see the small suture And this suture is too important. If we do the stretching here and we can bring the effect in the suture, we are putting the tilak here and we are stimulating this area by the various method. And this area is wonderful for the treatment purpose and it's treating many diseases. We will be discussing that, right? So the name of this suture is called Metopic suture. Metopic, I will show you in the image. This suture is very important and we are using the suture for the treatment of sensory organ. We'll be discussing shortly. You can see here, this is written Metopic suture. The Metopic suture or any suture just can be activated by the color therapy. Only by the color therapy, even needle is not required. The color therapy is enough to activate the suture. So if the person is having too much heat in the body, too much fire in the brain, we can put the cooling color here. We can put the cooling color here. Like people are putting sandalwood. If you are putting the sandalwood here, it will cool the metopic suture. And the metopic suture is very good. If the person is having redness in the eyes, this suture is wonderful. This suture is one of the great suture who treat all types of sensory disorders, like the problem of the eyes, problem of the nose, problem of the mouth, problem of the ear, any sensory problem. If we want to treat any sensory problem, we can just treat by the metopic suture. Many person putting the tilak here in a one line, and many person putting the tilak like in the two lines. They are making a very beautiful circle and putting the tilak in the two line. So there are various methods to activate the suture, but ultimately the suture is one of the great suture for activating your sensory organ, your senses. And if you are activating the suture every day, then it is helping to develop the sixth senses. Sixth senses. We are telling, oh, you are having good sixth sense. So this suture is connected with the metopic suture is connected with the senses. Now, if we go up with the help of acupuncture, scalp acupuncture, the results in the hearing disorders, tinnitus, deafness are 60 to 70%. Okay. So now if we are going from this suture, then we do the continuous journey from here. Then these are the two parietal bone. The right side and the left side parietal bone are fused with each other. So with the help of suture here, and if we try to separate these two bones here like that, then we can bring the effect in the suture. We can release the unwanted stress from the suture, and the person is getting a relaxation in the headache. So we can do this exercise every day if we are having headache or heaviness in the head. Just keep your both the hands here. Then with the help of both fingers, you can try to separate the suture. The name of this suture is sagittal. Sagittal suture. The sagittal suture, one of the great suture. With the help of sagittal suture, we can treat the trunk part. Trunk, right? Trunk means if we see the body like this, then this part is called trunk. This part is trunk. So suppose someone is having problem in the heart, the problem in the lung, liver, gallbladder, stomach, spleen, kidney, anywhere in the trunk, we can bring very good effect with the help of this another suture that is called sagittal suture. This one. The sagittal suture is found between two bones, one side parietal bone and the other side parietal bone. With the help of the suture, we can release unwanted pressure from the heart, lungs, liver, and each and every organ found in the trunk part, torso part. Okay. So in that way, like suppose from the this is the midpoint of the eyebrows. This is the midpoint of the eyebrows, and the name of this part is called glabella. Remember, glabella. So I'm writing here so you can. So if we see this part, the central part here, the name of this part is glabella. G L A B E double L A, glabella. Or we are telling in the normal language it third eye. Or as per the acupuncture, this is the tranquilizer point. Okay. And the name of this point is yin tang as per the acupuncture. So this is the very important point. The name of this point is glabella, right? Then if we are moving on the suture here, so look at the suture. So I told you this is the front suture that is called metopic. There's a back suture that is called sagittal suture, sagittal. Now between these two, there is a gap in the newborn. There is a gap in the newborn. So let's see here. Look at here in the other image. So if we look at here, this is the frontal bone. Look at here, this is the frontal bone, and this is the parietal bone. So this front suture is called metopic, and the back suture is called sagittal. And in between, we are having one junction. So now I would like to talk to you about the junction. If you, in the newborn baby, if you touch here, you can feel the soft part. So that soft part is nothing but a junction between the frontal bone and the parietal bone. The suturing work is going on. So this is the frontal bone and this is the parietal bone. If you see here, you can see the junction here. Can you see the junction? So if we are not able to find the junction, it's a very easy method, I will tell you. So first we have to reach to the hairline. How to reach to the hairline? With the help of forefinger. If we keep the forefinger from the third eye, then we are reaching to the hairline. So the length from here to here is 3 chun. Now from here, if we are keeping 3 fingers or the 2 chun, then we will reaching to the anterior fontanel. We are reaching on the pit or the depression or the soft part available in the newborn baby. This is called anterior fontanel, the junction between frontal bone and the parietal bone, the junction between metopic suture and the sagittal suture. This is called anterior fontanel. Okay, fontanel means hole, ditch. So there's a very important part I will show you in this image. So this is the part. This is the anterior fontanel. The other name of this is bregma. B-R-E-G-A, bregma. So the meaning of bregma means the junction between frontal and parietal bone, that is bregma, right? So how many of you can find out bregma? Tell me. Search your bregma. If you find, then tell me. You know, when there is an accident is going on, someone inside the train, someone inside the bus, and the accident going on, why the people are dying? You know, because the luggage, the material, all the things inside, they are just jumping on each other. Okay. Suppose someone is skull is very, very tough, but someone is getting the accident. So there is internal bleeding, internal bleeding. Some it's not coming out. There is internal bleeding, and even without the injury, person is dying. Okay. Because ultimately it's very hard, but we are a human. Okay. We are a human. Even if doctor want to open, they can open by drilling. So this is the very hard, but it's still it's have some limitation. So the question, why the people dying after the accident? Because it's a depend on the frequency, it depend on the pressure, how much pressure, opposite pressure has applied during the accident. Okay. So accident, there will be internal injury, internal bleeding. Because of internal part is just, there is internal accident, outer accident, there is internal accident, rupturing of the blood vessels, and because of the bleeding, then the person are dying, or even the getting paralysis. So how many person got the bregma? Neti in the Kannada, okay, neti, bregma. So bregma is the very important part, bregma. If you look at the bregma here, this is a very important part. So when the kids are small, we are putting the castor oil here. We are putting the coconut oil here, castor oil here, for the purpose so that there should be faster healing, right? So now from the bregma, if we are going back on the back side, right? On the back side, then we are getting another bone. The name of that bone is occipital bone. Occipital bone. You can see the occipital bone here. Can you see the occipital bone? So there's only single occipital bone. Single occipital bone, right? So now, have you seen the like the people, ABC, the doing spiritual practices, and even traditionally, many people are keeping the choti here, sikha, choti, or here, just here on the back side. Why they are keeping there? Because when the parietal bone is ending and occipital bone is starting. The junction is very much important. Again, there is a one junction. So this parietal bone is ending and the occipital bone on the backbone this is starting. There is a junction. That junction is very highly important and it's more sensitive. Even it's more sensitive than this junction. So even they are going for the barber shop, but they are not allowed to cut these hairs. Because in the spirituality, it has been, this is a thought that when we are meditating, we are getting lots of connectivity from this cosmos through that channel that is called the junction between the parietal bone and the occipital bone. We can feel the depression. So this is the depression once again. Have you found this depression? How many person can feel this depression? You will find this depression 4, 4, and 3. After the 11th finger, if you measure from here, 11th finger, 4, 4, and 3, then you are going to find one depression. That is the place, where we are having big fontanel. That is called posterior fontanel, and this bone are ending and occipital bone are starting. That place is highly important. That place is called the place who get connection from this cosmos during the spiritual practices. So I will show you that place now in this image. If you see this image, then we are going on the back side. This is the parietal bone. This is also the parietal bone, and the backside bone is the occipital bone. And again, we can feel the junction here. This is the same junction where we are keeping the sikha or the hair. So this is called posterior fontanel, and the other name of this depression is lambda. 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 It's a very important. We are going to discuss this in more detail. Let's see in this image. So this is the frontal bone, this is the parietal bone, and the backside is the occipital bone. And on the junction, we will be having here, that is lambda. 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 Right? If we keep on going, then we will be reaching to the posterior hairline. So here we are having posterior hairline. Posterior hairline. Right now, I would like to show you one point on the posterior hairline. And on the posterior hairline, we can feel the depression here. Can you feel the depression here? The meaning of posterior hairline, where all the hair are ending. So all the hair are ending, and we can feel the depression here. So why we can feel the depression here? Why the depression? The depression is there due to some reason. I will tell you. So if be the posterior hairline, we will find the depression there. I would like to bring a focus on the depression. You know why the depression is there. In the neck, how many bones we have? How many vertebrae we have in the neck? So look at the scalp, right? So if we see this neck part, the total length of the neck is 3 children. We can measure with the help of 4 fingers. And we can feel the depression here. Can you feel the depression here? So if your neck is, if your head is ending, we can feel the depression here. So this depression is there. This is the place of C1 vertebra, cervical 1 vertebra, right? Because all the vertebrae are having a spinous process, which we can feel on the back side. But C1 vertebra is not having any spinous process. Okay. So C1 vertebra is without the spinous process. So we can feel the depression, and where we are feeling the depression, that is the place which is called the ending of the occiput, ending of the head, and the place of C1 cervical vertebra. Fine. So after that, if we go down, we can feel one bony prominence, that is cervical 2. So the depression is cervical 1 and the bony prominence is cervical 2. So coming back to the depression, comfortable? Coming back to the depression or the cervical 1. From this cervical 1, if we are going up, we can feel the bone here, that is the occipital bone, right? So that is the occipital. So now I am coming here down to the depression. So when I am doing the treatment in this depression, this is the point which is called the master key point of tinnitus, or the master key point of ringing sound in the ear, right? Very special point given by the Dr. Yamamoto. So right now my main focus is something else. So in this depression only, because we know this is the depression. When I'm searching this point is not exactly in this depression. This point is on the border of upper bony prominence. So definitely this point in the depression, but just in the uppermost part of this depression, where we can feel this bony prominence of this occipital bone. So the upper part is the part that is called the point of tinnitus. And if I'm going down, I'm feeling the depression. So I can keep my 2 fingers. One finger I have kept in the depression, and the another finger I am touching the lower part of the occipit bone. That is the point of tinnitus, and this is the depression or the cervical 1. So if I ask you the sequence, then you can tell the first is the tinnitus point, second is the cervical 1. Fine. So now the main thing is here, if we are going up at the lowermost margin of this occipital bone, and we are going on the both side. This is the very excellent point. This is the very excellent point because this point is called the master point of whole body. The master point of whole body. So here we are having 2 points. Again, first we are touching the depression here. So this is the cervical 1. Then we are going on the uppermost prominence, that is the tinnitus point. Now from the tinnitus point, if we are going both the side, that is the master point of whole body. So this is the master point of whole body, and this is also the master point of whole body. Now you can see my finger is here. So this is the master point of whole body. Here only we have with the 1 millimeter, one, we can tell very minimal gap. We are having master point of upper body and the master point of lower body. Both the point just to locate it on the both side of the depression. So suppose I have kept my index finger on the depression, my index finger on the depression here, right? So this is the depression, index finger in depression. Now this is the cervical one. So now I am touching the uppermost prominence here, that is the point of tinnitus. Now from the tinnitus, if I go both the side, so this is the master point of the upper body and the master point of the lower body. So when we are giving the treatment of Yamamoto New Scalp acupuncture, we should always start the treatment from this point. From this point. So we should always start the treatment from this point, or we should not forget this point. So whether we should put the needle, yes, we can put the needle, or we can do the stimulation very gently without the needle. How to stimulate? We will tell the patient lie down, and just we will keep our finger here and will tell the patient lie down. Suppose patient is lying down like that. Or I can press my palm on the forehead. I can press my palm on the forehead and my other palm, other finger on these points. Look at here. And just I am pressing opposite to each other, and I have to stimulate this point minimum for 30 seconds to 1 minute. Just a very gentle touch. Do not press this point. So first I will feel the depression. Then I will keep my two finger here on the both side of the depression. I will remove the middle finger. Okay, now just I will be stimulating this point for 30 minutes. Or I can stimulate the point with the help of any finger which is comfortable for me. My favorite posture is the lying down. I am telling the patient lie down. So this is my favorite posture. I am telling the patient lie down on the bed, and I am bending my fingers and keeping under the occiput area here, keeping under the occiput area here, holding this part, and just I am doing the stimulation in that. So I am not giving any pressure. Patient is lying down. When the patient is lying down, head is going down, and the pressure is coming automatically. So this is the stimulation of the master point of upper body and the master point of lower body. If we do this for 3 minutes, you will get surprised. All the problems are going away. One day I did this treatment to one of the patients suffering with the tremors in the arm and the Parkinson, and even tremors in the leg. I did this activation for 3 minutes, and patient got wonderful results. So in that way, we can see in this image, this is the cervical one, which is the depression. On the both side, this is the master point, and upper also the master point. Upper one is the master point of upper body, and the lower is the master point of lower body. And in the center, we have master point of tinnitus. I will show you another video. Give me 1 minute. So we can see in this image once again, the master key point of tinnitus and upper body master key point and the lower body master key point. So we are stimulating this point. We are telling the patient lie down. You can see in this image. And we are pointing the finger toward this, and there is a gentle pressure because of the head of the patient. We can stimulate this point for 3 minutes if we want to create a very good results. The discovery of this point has created very great results by the Yamamoto. You can see this is the very wonderful posture which we are doing, which we are using. Here we are just touching the point. We are not trying to give pressure or manipulate the point here. Just touching the master key point here is creating the results. So when we are touching the point, first we are giving intention of the master key point of lower body. Then we are doing intention of the master key point of upper body, because the location of points are very much near. Okay. So we will continue our discussion tomorrow. So now we are doing the break for 5 minutes. Then we'll discuss in Hindi. Okay. 5 मिनट का ब्रेक करके हिंदी में डिस्कस करेंगे. Thank you so much.